Gregory Johnson, and we have Haley here with us today. And Haley came to see us on referral from her mother, and her mother was referred by some other patients of ours, friends. So Haley's here to see us for her scoliosis, and she's got a pretty severe scoliosis. It actually measures 37 degrees by the Cobb angle method with the apex at T6, T7 on the right convexity. And then down in the lumbar spine, and the convexity is to the left with the apex at L1 and L2, and that measures 45 degrees by the Cobb angle, which is pretty significant scoliosis. And this is your sixth treatment so far, huh? Mm-hmm. And your numbers are pretty low. Mm-hmm. That's good, so that's looking good. Let's have you face the mirror here. We're going to check your posture first. Let's have you close your eyes, Haley, and bend your head forward and backwards for me. And then neutral. Okay. Hold still for just a moment. Okay, you can see her head's translated a little bit to the left of center, and her body's kind of tilted off to the right here. That's a part of the scoliosis. Her pelvis has shifted to the right of center. You don't see any room here, but you see quite a bit of room over here, and that's because her apex of her scoliosis goes way out to the left over here, pushing her pelvis way over to the right. So the very best treatment that we provide for any scoliosis patient, and they called yours an idiopathic scoliosis at the orthopedics office, right? Mm-hmm. And we found out by looking at your x-rays that it was not idiopathic. It was actually because of structural misalignments, correct? Mm-hmm. Yeah. So we're not calling the orthopedics who said that idiots, but it's not an idiopathic scoliosis. Let's go ahead and lay on your back for me. This is Haley's favorite. Get her pinned in here good and tight. Slide up just a little bit where your hips right under there. Good. There we go. In there tight enough? Yeah. It's our weight reduction program too. So we're filling this up today on our new YouTube channel, Advanced Chiropractic Relief LLC, and it is up and running. We had like 450 subscribers overnight, and we really appreciate you subscribing to our new channel and sharing it with your friends. Just breathe through your nose. Oh yeah. You feel that all the way down? Okay. There we go. And yes, she's still kicking. A little bit, not much.
Hanging on.
Yeah. Not hang over, hanging on. There we go. Yes, very nice. You like that a lot better, huh?
Yeah.
Yeah. So this is the y-axis, and I'm going to give you an example. If I had a crooked chain that looked like a snake that went from here up to her head, and I nailed that chain in right here and lifted straight up on the chain, what would happen to the chain? Straighten it out, wouldn't it? Well, you have a chain of 24 freely movable vertebrae in your spine from your skull down to your pelvis. Let's come over this way now and you tell me. So the principle works the same. The problem with these scoliosis is that a lot of people grow up with these things from childhood. So that's why it's really important to get your children checked early, because if you are in gymnastics or any kind of sports activities when you're young and you misalign your spine and you don't correct those misalignments or subluxations, they can develop into functional scoliosis, which is a painful and serious condition. But they can be helped early on and prevented with proper chiropractic care. Okay, so you're going to feel your pelvis pop up here and you relax. Adjust your left SI joint first. And see, her right SI joint, because of it having more of the weight bearing on it, has internally rotated as well. And her sacrum straight down away from L5. And I'm going to adjust her L5 straight P to A here. There. And I'm also putting a little bit of right to left drive into it, just because the scoliosis apex is out to the left here in her thoracolumbar spine region. And then, excellent. And just breathe. Good. Okay. Yeah, I still got one right here. Okay, Tuffy. So I'm going to do a new adjustment on you today.
Okay.
That you haven't had done. It's new to you, not to me. Let's have you lay on your right side and put your right hip on top of this pad, this roll. Again, I'm going to create a pre-stressed area here in her thoracolumbar spine by elevating her pelvis here. Now I'm not going to twist her or rotate her. No, go ahead and just lay sideways. Keep your straight right there. Have your head right there. Okay, and what I'm going to do is I'm going to come directly down into the apex of this scoliosis, creating, in biophysics terminology and mathematical terminology, a catastrophe effect. And catastrophe is not bad in this situation. Okay, let's go on your back now. A catastrophe effect in mathematics and physics is pre-stressing an area and then creating a maximum point of leverage there. Now I got some more movement even out of her spine doing it that way. So now we're going to adjust her from the lower end here. Okay, just breathe and relax. There you go. And same thing here. Nope, that's not it. Nope, that's still not it. Breathe. There. Boy, making me work for you today, huh? Okay, so now I'm going to adjust her cervical thoracic spine back in the X, Y, and Z axes. This is mostly externally and rotating on the X axis, and then also backwards on the Z axis, straight down just a tiny bit right there, good. And put your arms out like this. Now when you have scoliosis with those big cob angles, you get misalignment not only in the costovertebral areas in the spine, but also up front here in the costosternal areas where the ribs attach to the sternum. And those are a little sore, aren't they? Especially this guy right there.
Yeah.
Okay, nice deep breath in. Let all your air out. Now I'm just pulling her stomach back down through her diaphragm a little bit to open up that area in her lungs and let her breathe a little easier. Okay, one more time. Exhale. Great. Hang on, let me just check, make sure you're got one more pelvic adjustment right here. I'm adjusting her anterior superior iliac spine here, ASIS. Very good. Okay, now let's hit you up face toward Joseph. Okay. There we go. Good. And how many years have you been dealing with your scoliosis, Haley, for our YouTube fans? That you've known about?
I don't know. I just remember when I was little, I would go to the doctor.
And they told you had it back then?
But then my mom
nobody's ever done anything about it, have they?
Yeah, my mom didn't want to put me to brace because I was a rebellious
Well, that's
kid.
good. Well, that's good. And it's smart not to be getting any Harrington rods put in there unless you have organ pathology or heart disease because of that. Okay, good. Let's go ahead and have you stand in front of the mirror. We had a patient's family bring a really, really severe scoliotic patient in last week. Flex your head forward and backwards. and the orthopedic and neurosurgeon wanted to put a Harrington rod from the skull all the way down to the lumbar spine and pelvis. But this child of 14 has not even fully developed yet. Look up. Feel a little tap there. Another little tap there. Now shift your pelvis straight left for me a little bit more. No, this way.
Oh.
That left. There you go. And one more right there. Okay. Now let's try that same thing again. Very nice. Now look here. See how it's more even now?
Mm-hmm.
You got equal spacing
Yeah.
down here now instead of it being shifted way to the right. And your shoulders are level too. So this is how we take care of moderate, severe scoliosis patients. And this is your Houston chiropractor coming to you from Advanced Chiropractic Relief LLC in Houston, Texas. We'll see you next time.